Hey, it's Nick Fogelson from Northwest Endometriosis and Pelvic Surgery. Let's continue with our series of questions I get about hysterectomies a lot. So the first one was, does a hysterectomy treat endometriosis? And if you didn't catch that, go back on my history and watch that. So the next one I want to talk about is that, does doing a hysterectomy at the time of endometriosis surgery reduce recurrence in the future? It's an interesting question because it gets into the question of, like, why do people have endometriosis in the first place? Because if you decide that question, you might wonder whether or not the hysterectomy would affect recurrence or not. So the first thing I'm going to say, the question of does a hysterectomy after endometriosis excision prevent recurrence, from an evidence-based point of view, the answer is we don't know. This has not been studied. No one has ever done a study that has looked at patients having thorough excisional surgery who have hysterectomies or not have hysterectomies, and then gone back and rescoped them and found out if they are more or less likely to have recurrent endometriosis. That study's never been done. It's probably not ethical to do. It probably will never be done. So from a point of view of evidence, the answer is I don't know. So then you have to go from just experience. There was a study in 2005 that looked at hysterectomy with removal of ovaries at the time of endometriosis surgery. And it did show that that procedure had a significant reduction in the incidence of recurrent pain relative to not doing that. However, that was done in 2005. There wasn't a lot of excision going on. So those procedures were probably removing uteruses and ovaries without removing all the endometriosis. Because back then, removing endometriosis was like really uncommon. And so that study showed that removal of the uterus and ovaries was better than not doing that with whatever endometriosis surgery they were doing, but they probably weren't doing really thorough endometriosis excision. So I don't know if that, in fact, I think that data probably can't be extrapolated into where we are now. So the question is now, does removing your uterus make you less likely to recur from endometriosis? And my sense is that probably it does. And I say that because I have been doing this for 15 or more years. I mean, 25 years of being a gynecologic surgeon, over 10 to 15 years of being exclusively an endometriosis surgeon. So I've seen tons and tons and tons of people. When people have endometriosis thoroughly removed and they remove their uterus, my general sense is that the likelihood that they have recurrent pain is lower. And furthermore, if you do reoperate on them, I think the likelihood of recurrent endometriosis is lower also. There is sort of a theory that endometriosis is put there from the moment you're born. This Endometriosis theory. David Redwine was really a proponent of this theory. And under that theory, if you remove it once, it'll never come back. Problem is that people, it can't be completely true, because there are definitely people that have recurrence right in the center of where endometriosis was excised. I could show you lots of videos of people who've very thoroughly removed endometriosis. Anybody would say the endometriosis was thoroughly removed. You can go back years later, the patient has recurrent pain, you reoperate, and there's endometriosis right where you were operating before. So some people do have recurrence. The question is, why is the recurrence happening? So one theory would be that you're having more of this metaplasia, like the cells are transforming into endometriotic cells, and that's why it's happening, in which case the uterus wouldn't really matter. But there's the other theory of retrograde menstruation, which is the older theory, which suggests that cells are translocating out of the inside of the uterus, out of the fallopian tubes, into the pelvis, and they're sticking, and that's what's causing endometriosis. There are some people that feel violently or very seriously that that's not the case. But I will tell you, as a person who I consider myself a scientist, I do not think that retrograde menstruation has been disproven. There's people that say it's a debunked theory. Well, the only person that really said that was David Redwine, and then lots of people kind of parroted him. But I don't really think that there is definitively proof that that doesn't happen. And in fact, it does happen in animals. If you take endometrial cells out of an animal and you put that into the peritoneum and you do it frequently, they very frequently develop a condition that looks very much like endometriosis. Furthermore, we see right-sided diaphragmatic endometriosis almost exclusively. It's rarely on the left. And you also see right-sided, when people have gonorrhea and they get inflammation of their liver, it's almost always on the right side of their liver. And it's because it seems like the peritoneal fluid, for whatever reason, gets up on the right side more than the left. So that would kind of go along with the idea that the endometriosis is traveling up from the pelvis up to the diaphragm. So that would kind of go along with kind of that theory as well. So the reason why I say that is that if retrograde menstruation is a part of the endometriosis process, at least in some people, in those people, if they have a hysterectomy at the time of removal of endometriosis, they are less likely to have recurrence. I mean, if that's the only reason they're getting endometriosis, then they will not recur because the uterus will not be there. My clinical experience is that people that have a hysterectomy at the time of endometriosis excision are far less likely to have recurrent pain in the future. And whether or not that is because they have uterine source pain or whether it is because of endometriosis is a little bit hard to tease out. But I can tell you that the uterus coming out helps them. Now, obviously, if they want to have children, it's not a good option. But if they don't want to have children, I generally encourage people to have their uterus out for doing endometriosis surgery, because I can just tell you over a decade of experience, more than 15 years of experience, that the people that have the uterus out are just way more likely to be good for the rest of their life without ever having anything else needing to be done. And I also think that, and again, this is not hard data, this is just my own experience, I do think that the incidence of actually finding recurrent endometriosis is lower if the uterus is out. So that question of does removing endometriosis prevent recurrence, from an evidence-based point of view, I don't know. From an experience point of view, I think the answer is yes, at least in some people, I think it does. So next thing we're going to talk about, a weird question I often get. When the uterus is taken out, what fills the space? I always think that's a weird question, but people ask me that all the time. So that's the next one.